Today we will going to see the diseases of nervous system. In that we will see the epilepsy. Now see here, we know epilepsy actually surroundings. We see in the patients, the individuals, isn't it? But what do you mean by epilepsy? Means the seizures, fits, isn't it? We know that one meanings, fits, seizures. So epilepsy means what? Epilepsy is a chronic convulsive disorder of central nervous system. It is characterized by sudden loss or impairment of the consciousness. Now I will explain one by one. See, epilepsy is a chronic convulsive disorder of CNS. It is actually disorder of the central nervous system. Here, the convulsions will appear, the fits will appear. Okay, due to what? Due to by the some damages in the central nervous system. Okay, little disorders of the central nervous system. Okay, and due to that, what happened? Sudden loss or impairment of the consciousness. Sudden the individual will get unconsciousness or sometimes impaired consciousness, little, not totally unconsciousness, little consciousness will hamper. Okay, so I will read once again. I will tell you, epilepsy is a chronic convulsive disorder of CNS, central nervous system. Okay, by sudden loss or impairment of the consciousness. Suddenly the patient will get unconscious or sometime little impairment will take place in the consciousness, alertness. Okay, usually but not always with characteristic body movements, sometimes with hyper autonomic activity. Now see, the activity means which activity? Okay, which activity here? Body movements. Sometimes the jerky movements will take place. The individual shows the jerky movements, isn't it? The teeth, they will shows the something difference, isn't it? So that's why in the severe case, what we will do? Due to that, to avoid that one, we will put some hard material in that mouth, in the individual's mouth. So they will chew like anything. Sometimes there is a danger of cutting of the tongue also happens. So the activity, body movements, sometimes it is too much, isn't it? So this is a danger. It is a very complicated. Actually, this epilepsy is too much complexity. But here I will explain you in a very simple manner. Okay. Otherwise, if you will learn in the book, it is a too complex one. So little simplicity I made in that, and you see here, if any problem, you ask me in between. Okay. So are you understood this one? What do you mean by epilepsy? What happens here in the epilepsy? It is a disorder. Which disorder it is? Which part? Nervous system, central nervous system. Okay. What happened here? The convulsions are there. The fits are developed. Due to that, the individual will sometimes suddenly it hampers, suddenly got unconsciousness or otherwise impairment of the consciousness. Little it hampers in the consciousness, alertness. Okay. And the characteristic body movements are there. The jerky movements will take place. Okay. With hyper autonomic activity means what? Autonomic activity. The body movements are sometimes tremendous. isn't it? Now see the types of the epilepsy. Grand mal epilepsy, or it is also called as a major epilepsy. Then petite mal epilepsy, temporal lobe epilepsy, cortical focal epilepsy, hips arrhythmia. These are the 5 types of the epilepsy. Okay, if you will study in detail, that is too much study. Okay, so here the little what we need, that only we will see. Otherwise, it is too much complex one, isn't it? So grand mal epilepsy means what? Major epilepsy. Petite mal epilepsy, temporal lobe epilepsy, specific part is there. Cortical focal epilepsy, specific area of that one. If damaged, it is called as a that type of the epilepsy. And hips arrhythmia, it is very dangerous. We will see the grand mal epilepsy or major epilepsy. Actually, this is major epilepsy. It is characterized by sudden loss of consciousness and major convulsions with tonic spasm and clonic jerking of the body movement. Are you getting spasm? Means too much spasm, you know, what we call in Marathi, spasm, contractions, isn't it? Sudden spasm, contract, the body will contract like anything. And the clonic jerking of the body, the movements are there, jerking movements, continuously jerking movements are there, shaking. Okay, that jerking movements are there. So it is characterized by this is the major epilepsy. So what happens here? Loss of consciousness. The individual will be unconscious, suddenly unconscious, isn't it? It is generally characterized by sudden loss of, immediate sudden loss of consciousness and major convulsions. Too much jerky movements are there, too much fits is there. Are you observed anytime? Surroundings or in picture, in serials, TV serials, or somewhere else, the individual like this? No one? Don't know? Fits, convulsions? Not a single person? Unmute and tell me. Am I audible, all of you?
Yes, ma'am.
Then tell me, no, frankly. If seen, tell me. We know this type of disease. Or otherwise say directly, no, we don't know. Are you knowing about this one? Huh? If you will keep mum, there is no any communication. Just I am teaching and you are hearing, or what you are doing, I don't know. If you will communicate, that is very easy, very nice, understanding one, isn't it? So are you getting my point? All of you? Are you getting my point?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Not a single time you've seen this type of convulsions, fits to any individual? Okay, let it be. Grand mal epilepsy means what? It is characterized by sudden loss of consciousness and major convulsions with tonic spasm. Too much contract, the body will contract like anything. And clonic jerking movement of the body is too much clonic. And attacks can occur at any age. It's not like that in the children, in the middle age, or in the elder patient. No, these are not according to our age, isn't it? So these attacks can occur at any age, infantile also, children's also, young age also, or sometimes due to brain damage. We will see in the etiology, and elder patients also. This is not depend on the age. You keep in your mind. This is not depend on the age. All the disease like hypertension, BP, all these are depending on the age sometime, isn't it? So here in this epilepsy, in this disease is not depending on the age. The attacks can occur at any age. Okay, so petite epilepsy, but some epilepsies are there, they are due to genetic problems are there. We will see in the etiology, they are hamper in the infantile age only. Okay, so we will see in the etiology. Now see the petite epilepsy. It is characterized by episodes of impairment of the consciousness. Here, little impairment in the consciousness hamper. But what is there in the grand mal epilepsy? Sudden, totally loss of the consciousness is there. But here in the petite epilepsy, impairment of the consciousness associated with bilateral clonic motor activity. Bilateral, both the sides. The movements are there, motor activity. The hand will shake, the leg will shake, the eyes will blink, eyelid will blink. So many activities are there, motor activity. Okay, so these are how bilateral, both the sides with bilateral clonic motor activity such as eyelid blinking, such as here only one of the example they told you, that is the any type of the bilateral eyelid blinking, like the eyelid blinking. Now you will see here the etiology so that you understood. Genetic factor, it is also due to the genetic factor. What is there in this genetic factor? Some of the genes will be hampered, some of the genes will affect, and due to that, the epilepsy will occur. Some types of the epilepsy which are characterized by the type of the seizure experience. Which type of the seizure they experience? Okay, according to that, and the part of the brain that is affected. Actually, this is a CNS total, but which part is affecting? According to that, also the uh, the type of the seizure will affect. The type of the seizure is there. Okay, according to the type of the brain affected. Okay, that run families due to the genetic influence. The genes will transferred from mother to the offspring. Okay, so here the researchers have linked sometimes of the epilepsy. This is actually vast study. You keep in your mind that here, due to the affected, this will genetic factor means what? Some of the in the age only, in the uterus only, in the mother's womb only, some affect, the mother will affect, or sometimes what happen, the children's will infected, the children's brain will be affected due to some infectious disease. So that's why the disease will happen, or sometimes the genes will transfer from parents to the offspring, and due to that, and due to some of the environmental conditions are like that, the genes will affect to that environment, and that causes the epilepsy. Okay, not every time, but due to that certain environmental conditions that will exaggerate, that will trigger, that will produces the seizures due to that environmental conditions. So some of the types are like that, which are characterized by the type of the seizure experience, or the due to the part of the brain that is affected too much. That is CNS is a big part, so little part will also affect. Which part? Frontal or back, or sometimes the whole, or sometimes what, frontal lobe only. So which part is affected, that type of the epilepsy will cause. Okay, due to that genetic influences, due to genetic influences, researchers have linked sometimes of the epilepsy to specific genes. Some of the specific genes are there that are linked, that are trigger to that type of the epilepsy. Though it is esteemed up to 500 genes are there, isn't it? That could be type to the conditions. So 500 genes are there that are tied to the type of the condition. Certain genes may make a person more sensitive to the environmental conditions that trigger the seizure here. See here, these environmental conditions are also affecting. Environmental conditions are also affecting to that specific type of the genes, and due to that it triggers the seizures, that produces the seizures, that produces the fits. Are you getting my point? Due to their specific environment, due to specific environmental conditions, because certain genes in our body are that are sensitive to that type of the environment. If we will go to that type of the environment, then only the seizures, then only the fits will appear, isn't it? Due to some conditions are also there, family backgrounds are also there. If we will see that type of the scene, then also the individual will fear, scare, and due to that the fits will be there. So the environment, totally we can say that environmental condition. The pictures are there sometimes, the scenes are there, the dramas are there in our life, isn't it? Some due to some accidental case, due to some other conditions, if the quarrel is there, if the family history is there, by seeing that condition, by seeing that moment, are you getting my point? So these are the genetic factors. Now see the head trauma. Head trauma as a result of any accident, not only the car accident, but any type of the accident in the home only. If individual will fall down on the head, that type of the accident will also there. Due to that trauma, it causes the injury to the brain and causes epilepsy. That part of the brain will be injured, and due to that head trauma, it causes the epilepsy. Okay, not only the car accident, any type of the accident. Okay, brain condition. Brain condition that causes the damage to the brain, such as brain tumors or strokes, can cause the epilepsy. Sometimes the patient will go into the stroke due to by seeing any type of the conditions or any type of the pressure, stress, it will go to the stroke. Suddenly the damage to that part of the brain, and due to that it causes the epilepsy. It causes the epilepsy, or sometimes due to the brain tumors, it causes the epilepsy. Stroke is a leading cause of the epilepsy in the adults older than the 35. Why it is called as? Because this age only we will take stress or something, sudden stroke, sudden, due to sudden information, due to sudden that type of the situation, the patients will have sudden stroke, the damage to that part of the brain, and due to that causes the epilepsy. Now the other condition, that is the infectious diseases such as meningitis, AIDS, and viral encephalitis can cause the epilepsy due to some infectious diseases. That is the meningitis, inflammation of the meninges, coverings of the brain, AIDS, and the viral encephalitis. Due to the viral infections, there may be the encephalitis, in inflammation of the encephalon, and that causes the epilepsy. Now, prenatal injury. Prenatal injury before the birth. Before the birth, babies are sensitive to the brain damage that could be caused by several factors. Which factors? Infection to the mother, poor nutrition, or oxygen deficiency. Many more factors are there. So I told you before also, in our brain, millions, trillions of cells are there. Some of the cells are like that in the brain. If sudden cut off the oxygen, the cells will damage permanently. The cells will damage permanently. So if in the mother's womb before birth, okay, there is a deficiency in the oxygen, it causes what? Epilepsy. So this is a very serious. So always again I will tell you here once again, isn't it? Because our health is like that. That is the God gift. How we have to maintain that one? Proper diet, proper exercise, isn't it? That factor will always come here while teaching HAP also, while teaching all these diseases also. Because if we are fit, not only by the diet is also compulsory and the exercise is also compulsory. In the exercise, too many are there, not only the body movements, but here yogasana, pranayam also very necessary because oxygen deficiency is there. What happen? The cells will damage, and this is the one of the cause to cause the cause the disease of the CNS. Okay, before birth, what happened? The babies are sensitive to the brain damage that could be caused by several factors. Which are those one? Infection in the mother's womb. Okay, poor nutrition. If the mother will not take any type of the diet or what we called as proper nutrition, if it is poor, then also if the brain, while developing the brain, if the mother is not uh, on the proper nutrition, that also one of the cause. And another cause, that is the oxygen deficiency. This brain damage can result in epilepsy or cerebral palsy. Cerebral palsy, another name for the epilepsy. Okay, cerebral palsy, that is the damaging of the brain, that is the epilepsy. Okay, these are the causes. Developmental disorders. Developmental disorders such as autism means what? Mental condition in which difficult to communicate with the pupil, difficulty to communicate with the other people, that is the autism. Okay, disorder, that is the mental disorder, it is a mental disorder. And neurofibromatosis means what? Neurofibromas means what? It is a tumor. Neurofibromas means what? It is a tumor. Developmental disorders, epilepsy can be associated with the developmental disorders such as autism. Autism, that is one of the mental disorder. Okay, in that disease, in that disorder, the people will not communicate with the other people. Okay, difficulty in that. And neurofibromatosis means it is the tumor. Okay, these are the what? Etiology, causes of that epilepsy. Which are the genetic factor is there, head injury is there due to the brain condition, infectious diseases, prenatal injury. Before the birth, the babies will affect that time, the prenatal injury, and the developmental disorders. Now we will see the pathogenesis. Actually, this is the very complex disease. Too much simplification I made here to understand you people. Are you getting this epilepsy? Actually, too much vast is there, vast syllabus is there, central nervous system. If you will go in the depth, you will not capture all the things. So too much simplification I made here. Whatever it is needed, important things only I am describing here. So pathogenesis means what? How the disease develops. Means it is the, what we call gradual development of the disease. Pathogenesis. Are you getting up till now? Are you understood?
Yes, ma'am. Yes, ma'am.
Yes.
Okay. If any problem, you ask me. Okay. Because it is vast one, this disease. If you know the CNS, if you know the brain, that is the complex one, isn't it? So pathogenesis, I will tell you here how the mechanism, which mechanism is responsible for this seizure. So see here, you know the excitatory and inhibitory, isn't it? The neurotransmitters are there. Due to that neurotransmitters, some of the neurotransmitters are exciting, some of the neurotransmitters are inhibitory in nature. Okay, sometimes what will happen if we will think some of the days morning only, if we will feel very nicely, isn't it? And sometimes what happens, we will feel very sadly, suddenly, due to what? These conditions, due to what? Because of these neurotransmitters, because of these secretions of the neurotransmitter. Some are healthy, some are inhibitory, some are excitatory, some are inhibitory. Sometimes we will excite like anything. Due to what? Due to these type of this neurotransmitter. But there should be balance in between. If the imbalance will take place, then the seizure will happen. Okay, the reduction in the inhibitory synaptic activity or enhances the excitatory synaptic activity may lead to seizures, that will lead to seizures or fits or epilepsy. The neurotransmitters like amino acids, GABA, gamma aminobutyric acid, this GABA is inhibitory in action, and glutamate, these neurotransmitters are excitatory in actions, are prominently involved. Which type of the neurotransmitters are there? Too many neurotransmitters are there. But which type of the neurotransmitters are involved here? Actually, the amino acids, GABA, that is the gamma aminobutyric acid, and the glutamate. GABA actually the inhibitory in action, and glutamate, these are the excitatory in action. Okay, these type of the neurotransmitters are involved here. They plays a vital role in this seizure. Okay, now see, the level should be in balanced state, sodium and potassium. Sodium plays a very vital role in this in our body. Potassium stimulates the glutamate. Glutamate, excitatory in action. Who stimulates? The potassium. Yesterday or day before yesterday, we seen that one, isn't it? The kidney disease, in that renal failure. What happened if the kidney is not working properly? Then what happen if the drainage will not go outside? The fluid will remain inside due to that loss of functioning of the kidney, isn't it? Then what happen? The potassium will accumulate in the body. But what is the role here? See, the potassium stimulates the glutamate, and glutamate, that is excitatory, and which plays a vital role in the epilepsy. So all the ions, anions, everything should be in the balance. Isn't it how the God gift we have, but we are not taking care of that God gift, isn't it? So in the state of sodium ion channel also plays an important role during the neuronal firing. Neuronal firing, sodium, potassium, other, that is the neuronal firing recovery from the inactivated sodium channel is essential for the generation of action potential. While generating the action potential, the sodium plays a vital role in that. If there is any imbalance, then what happens? The seizure, the epilepsy will take place. Okay, this is the pathogenesis, development of the seizure. So keep in your mind that which type of the neurotransmitters are involved here. Amino acids, GABA and glutamate. Actually, sodium and potassium plays a vital role. If the potassium level is hyper, then what happen? The fits will takes place. The fits will appear, okay, in that individual. So while writing in the renal failure, the complexity is there, secondary chances, that is the CNS disorders, isn't it? You can write this one. Okay. The state of sodium ion channel, this also very important. Sodium ion in our body is very, very important. It has too many role in our body. How much saline we are giving, in which percentage we are giving? You tell me. 0.9%, isn't it? That 0.9%
0.9%.
is, yes, 0.9% is very essential, isn't it? You keep in your mind. Otherwise, what happens during this neuronal firing? If any damage, if any imbalance is there, then it causes in that action potential. In that action potential, if any imbalance is there, then what happens? The seizure will develop due to that. Asynchronized firing of that neurons, asynchronized. If it is synchronized, then it is okay. If it is asynchronized, sometimes low, sometimes higher, any type of, then it causes what? Epilepsy. This is all about the pathogenesis. Actually, it is too much fast. Only 4 lines are explained here, major one. Okay, are you getting little? Understand? Keep in your mind
Yes, ma'am.
this much only.
Yes, ma'am.
Inhibitory and excitatory. Okay, the neurotransmitters are there. The main important, that is the potassium. Okay, if it will improve it, if we will loaded in our if it increases in our body, due to that what happen? It stimulates the glutamate. Glutamate, it is the excitatory. Mute yourself, all of you. Unnecessary. Why you unmute? Disturbs no our class. Hello. Sanskruti. Please, Sanskruti Khaka. Mute yourself. Sanskruti Khaka. Sanskruti. Listen here now. Unmute. Why you are unmuting yourself unnecessarily, disturbing the class? Call me afterwards, Sanskruti. Now see here the diagnosis. History and clinical examination. This is the common things. History and clinical examination. Okay. Now see in this. What the doctor will see? After going that one, he will take the history. Which type of the seizures are there? What they will classify, they will ask you what type of the seizures are there, what are the signs and symptoms are there, isn't it? Am I audible, all of you?
Yes, ma'am.
Okay. So types of the seizure, etiology, causes of that seizure and associated with the psychiatric problems. The main problem is here only, psychiatric problems. So don't take stress and don't give stress to others. Unnecessary. Why to shout? Because of this, the neurons will hamper here, isn't it? Unnecessary. Due to that sudden, what happens? Too much angry and too much depression. It is worst condition of the brain. Due to that, all the disease will causes. Keep in your mind. So unnecessary, you should not be anger. Unnecessary, you should not be take the things deeply into your brain. Otherwise, what happen? All the psychiatric problems are here only. Okay. What is the history? They will ask you. Okay. So it hampers in the childhood also. Due to that, our family. according to our family, how our family members are there. If they are giving you too much trouble, sometimes they will give trouble like anything, isn't it? Mm, Due to that, also the psychiatric problem will arise, isn't it? This helps to classify. The doctor will ask you before that, before giving the treatment, they will ask you the history. What is the cause behind that one? They will ask you the types of the seizure. Means what is, we have to explain here the signs and symptoms of the diseases, isn't it? So etiology, causes, and associated with the psychiatric problems. Any problem is there, psychiatric problems are there, they will ask you, the doctor will ask you. Clinical examination of the patient helps to find out the cause of the seizure and severity of the attack. During the seizure, during the attack, whether the patient, whether the individual is completely unconsciousness or impairment in the consciousness is there, they will ask you, the doctor will ask you. Now see, the neurological examination means what? Here they will examine behavior of the individual, motor abilities of the individual, mental functioning, and other areas are examined to diagnose the conditions and type of the epilepsy. Here the all neurological condition they will examine. Blood test, due to some of the genes will secretes, due to that type of the genes, the seizures are associated with that. So in the blood test, if it is there, that type of the genes are there, appear, they will find out in the blood, then we can definitely, the doctor can diagnose definitely this, that person is having this and this type of the epilepsy, type of the epilepsy. Now electroencephalogram, EPG, in sorry, EEG, it is there. Electroencephalogram, EEG. Okay, electroencephalogram, EEG. That is the electrodes. We have to take the picture. How we are taking in the ECG, electrocardiogram, like that only. Here we will take the pictures of brain, pictures of brain. Okay, so electron encephalogram, EEG. In this stage, the electrodes are attached to the scalp, with the paste-like substances. Okay, how we are pasting by while taking the ECG, electrocardiogram, like that only. Here we to where we will paste, on the brain. The electrodes records the electrical activities of the brain. So how they will record? Due to that electrodes, they will record the electrical signals, the electrical activities, the sodium, potassium, that is the action potential, they will record. And due to that, we can understand here. How we are in understanding? By seeing the PQRST waves, like that. Here we will see the electrical activities, the electrical signals of the brain. Okay. Now CT scan, computerized. Here also what we will take, like the X-rays, we will take the cross-sectional images of the brain. Okay, by seeing the brain's picture, we can understand which type of the seizure is there, which type of the brain affect here. So due to what? Due to the tumors, or due to the bleeding, or due to any type of the cyst is there. By seeing the pictures, we can understood, we can diagnose the type of the seizure. Okay, and MRI, here also the detailed picture of the brain we will see by this MRI, magnetic radiations. So we can detect the abnormalities in the brain, and due to that, which type of the seizure is there, which type of the epilepsy is there, we can understand. Okay. Now function MRI, that is a functional MRI, measures the changes in the blood flow. This is also very important. If the sudden loss or sudden cutoff of the blood flow is there, the going to the brain, this causes the ischemia, and there is a stroke. Due to that sudden cutoff of the brain, cutoff of the blood flow, there is ischemia to that part of the brain, and that causes the stroke. This is one of the reason of the stroke, isn't it? So we can seeing this functional MRI, we can measure the blood flow, changes in the blood flow that occurs when the specific part of the brain are working. Which part of the brain not supplying the blood flow, that we can measure here. Okay. This functional MRI we are doing before the surgery to identify the exact location of the critical functions such as speech, movement, so that to avoid the injury to those areas while surgery. Okay. Areas are there. We see in the human anatomy and physiology, central nervous system. Okay. Last year in the 12th, specific areas are there in the brain. Speech, another area, hearing, another area, vision, another area, isn't it? Smell, another area. So to avoid all the damaging of all, we have to see the spatial location, the exact location of that critical area, which part of the brain is damaging. So that before surgery, we will do this one. Okay. Now PET, positron emission tomography, all these will means what we will take the pictures, photographs here. Okay. This is also one type of the scan. How we are scanning, this computerized scanning, CT scan is there, the MRI scanning is there. Like that, the positron emission tomography, another scan. PET, use a small amount of low dose of the radioactive material that is injected into the vein to help visualize the active area, visualize the active area of the brain and detect the abnormalities actual area of the abnormalities we can find out. Single photon emission computerized, they will click here, they will radioactive, this is the radioactive material now. So here we can take the images. There will be, if any damage is there, if any part functioning is not functioning well, then due to that radioactive substance, we can understood which part of the area is damaging. Okay, the exact location of the brain where the seizures are originating, that will signals, that will give the blink, that will blink there only due to that radioactive substance, isn't it? So neuropsychological test, here we will see. In this test, the thinking, memory, speech skills of the patients are too much problems are there in this. Okay. In this test, the thinking, memory, speech skills of the patients are assessed. The test is done to identify the affected area or affected part of the brain. This is the neuropsychological test. The main area we will check here. Okay. This is all about the diagnostic test. Which are those one? Actually, first of all, for every disease, history and clinical examination. Neurological examination, we will see here the behavioral, motor abilities, mental functions, and other. Blood test, which type of the genes here. Due to that, the patient is suffering from this epilepsy, we will check here. EEG, CT scan, MRI, functional MRI, here we will see the blood flow, which type of the, which artery of the brain supplying to the brain is cut off, giving the low blood flow, that we will measure here, that we will check here before the surgery. And this PET, this is also one type of the scanning. Here we will see the here we will give the small amount of the radioactive material that will injected into the brain, and that will detect the perfect active areas of the brain where the actual damage of the brain is there, that we will see here in the PET. Neuropsychological test, here we will identify the mostly specific areas that are affecting to the brain, that is the thinking, memory, and speech. Now we will see the treatment, that is the divided into three types. Actually, all the treatments they are dividing into the three types, that is the non-pharmacological measures, pharmacological measures, and actually lastly at the end surgery is there. Non-pharmacological agent measures means what? Before giving the actual treatment, what we will see that one, prevention is better than cure. So that one not here directly we are giving the drug treatment, but non-pharmacological agents. What type of the prevention we will take here? How we can avoid the disease or progression, how we can avoid that we will see here. Okay, so non-pharmacological measures means avoid the cycling, swimming, driving, or work above the ground level, isn't it? If the patient is suffering from this epilepsy or fits, then we have to avoid that individual the cycling, because if the patient is on the cycle, if the patient is in the water, if it is he is driving, then it is critical condition, isn't it? There may be chances of, what type of the chances are there here again? The accidental case will be there. So that's why we have to avoid that one. Discourage of any activity where the loss of awareness might be too serious. You should not uh, too much give angry or too much depression. You have to speak very sweetly to that patient. Take consciousness of that patient, that individual. Any type of the discouraging, it hampers. Again, that will exaggerate, that will progress the diseases, isn't it? So avoid that type of the activity to that type of the individual, to that individual. The permission to above work should be granted after 1 year of the symptoms free period. Means what? If the patient is completely cured, then we can give that type of the work activities we will grant there for cycling, swimming after 1 year, when when the individual is symptom free, when the individual is symptom free. So in that case, we can give the above, we can grant, we can give permission for all these one above activities. Okay, this is the non-pharmacological measures. Pharmacological measures means what? Here actually we are giving the drug treatment. 2 3 drug treatment you have to keep in your mind, that is the anticonvulsant drugs, we can call it as a anticonvulsant. Okay, so anticonvulsant drugs, phenytoin, clonazepam, diazepam, ethosuximide, methosuximide, carbamazepine, 2 3 drugs you have to keep in your mind, that is sufficient for your level. Okay, risk factors here you see the age, family history, head injury, stroke, other vascular diseases, dementia, that is the loss of the memory, the brain infection, seizure in the childhood. Okay, this is the risk factors. Due to that, it will exaggerate. Okay, are you getting this one? Now complications, falling, drowning, car accidents, okay, pregnancy complications, emotional health issues, and the status epilepticus, actually this is the medical terminal, medical emergency. Status epilepticus, this is the very serious condition in the epilepsy. We have to hospitalize that patient. That is called as the status epilepticus. Sudden unexplained death in the epilepsy. Sudden unexplained death in the epilepsy. In the epilepsy, the complexities are there, complications are there. Okay, falling, drowning, car accidents, pregnancy, complications, emotional health issues, status epilepticus. If you not treat properly, okay, but if you are give the permission to that individual to any type of the ground movements or any type of the cycling, drawing, or driving or other things, then what will happen? Again, the patient, the individual will, if the attack is there, in that attack, in that time of the attack, they will fall. Again, the complications will be there. If one part of the area is damaged, then due to that falling or drowning or due to that car accidents, what happened? what happen again, the another area will get damaged, and these are the complications. Pregnancy complications, if the lady is not having the epilepsy, then avoid that pregnancies, otherwise the complications are there, and the individual, the newborn baby, the baby will also affect due to that family history or genes, isn't it? Because the mother is like that only. Okay, emotional health issues, some emotional health are issues are there, and status epilepticus, and next one, sudden unexplained death in the epilepsy. Are you understood this one, all of you?
Yes, ma'am.
Okay, we will close here only.